When installing an isolated ground receptacle in a dental facility, it is indeed required to provide two insulated equipment grounding conductors to the box where the isolated ground receptacle will be installed. Let's delve into the reasons and implications of this requirement. Firstly, understanding the purpose of an isolated ground receptacle is crucial. An isolated ground receptacle, often identified by its orange color and a triangle marking, is designed to minimize electrical noise and interference that could affect sensitive electronic equipment. This is particularly important in environments like dental facilities where precise and accurate operation of equipment such as X-ray machines, dental drills, and computer systems is essential. Secondly, the standard equipment grounding conductor provides a path for fault current to return to the source, ensuring that overcurrent protective devices such as circuit breakers or fuses operate correctly to clear the fault. This grounding conductor is bonded to the metal enclosure of the electrical system and other non-current carrying metal parts to maintain them at or near ground potential, reducing the risk of electric shock. Thirdly, the isolated ground conductor serves a different purpose. It provides a separate, dedicated grounding path for the receptacle that is isolated from the normal equipment grounding system. This isolation helps to prevent noise and interference from other equipment connected to the same grounding system from affecting the sensitive equipment connected to the isolated ground receptacle. Fourthly, the requirement for two insulated equipment grounding conductors stems from the need to ensure both safety and performance. The first grounding conductor, the standard equipment grounding conductor, fulfills the safety function of providing a low impedance path for fault current. The second grounding conductor, the isolated ground conductor, fulfills the performance function of minimizing noise and interference. Fifthly, the National Electrical Code, or NEC, provides specific guidelines for the installation of isolated ground receptacles. While the NEC does not explicitly mandate the use of isolated ground receptacles in all dental facilities, it does outline the requirements for their installation when they are specified or required by the equipment manufacturer or other governing bodies. Sixthly, the NEC specifies that the isolated ground conductor must be insulated along its entire length and must terminate at the grounding busbar in the electrical panel. It must not be connected to the metal conduit boxes or other metal enclosures along its path. This isolation is essential to prevent noise and interference from being introduced into the isolated ground system. Seventhly, the standard equipment grounding conductor, on the other hand, is bonded to the metal conduit boxes and other metal enclosures as required by the NEC. This bonding ensures that all non-current carrying metal parts are maintained at or near ground potential, providing a path for fault current to return to the source. Eighthly, the installation of isolated ground receptacles requires careful attention to detail and adherence to the NEC guidelines. It is essential to use qualified electricians who are familiar with the requirements for isolated ground systems. Ninthly, the benefits of using isolated ground receptacles in dental facilities can be significant. By minimizing electrical noise and interference, isolated ground receptacles can help to improve the performance and reliability of sensitive equipment, reduce the risk of errors and malfunctions, and enhance the overall quality of patient care. Tenthly, it's important to note that not all equipment requires an isolated ground receptacle. The decision to use an isolated ground receptacle should be based on the specific requirements of the equipment and the recommendations of the manufacturer. 11thly, in summary, the requirement for two insulated equipment grounding conductors when installing an isolated ground receptacle in a dental facility is driven by the need to ensure both safety and performance. The standard equipment grounding conductor provides a path for fault current, while the isolated ground conductor minimizes noise and interference. By following the NEC guidelines and using qualified electricians, dental facilities can benefit from the advantages of isolated ground systems and ensure the safe and reliable operation of the sensitive equipment. 12thly, proper grounding techniques are fundamental to electrical safety. Grounding ensures that, in the event of a fault, the electricity will follow a safe path back to the source, tripping the circuit breaker and preventing electrical shock. This is why the NEC emphasizes the importance of a robust grounding system. 13thly, the isolated ground system takes this a step further by creating a separate, cleaner path for sensitive equipment. This dedicated path helps to prevent unwanted noise and interference from disrupting the operation of these devices. 14thly, when installing the two grounding conductors, it's crucial to use the correct size wire. The size of the grounding conductor is typically determined by the size of the circuit conductors, as specified in the NEC table 250.122. 15thly, both grounding conductors must be properly terminated. The standard equipment grounding conductor should be connected to the grounding terminal in the electrical box and to the grounding bar in the panel. The isolated ground conductor should be connected to the isolated ground terminal on the receptacle and to the designated isolated ground bus in the panel. 16thly, the isolated ground bus in the panel must be properly bonded to the main grounding electrode system. This ensures that the isolated ground system is effectively grounded and that any fault current will have a safe path back to the source. 17thly, the installation of isolated ground receptacles should be inspected and tested to verify that they are functioning correctly. This includes verifying the continuity of the grounding conductors and measuring the voltage between the isolated ground terminal and the standard equipment grounding terminal to ensure that there is no significant voltage difference. 18thly, in addition to the NEC, other standards and regulations may apply to the installation of isolated ground receptacles in dental facilities. These may include state and local electrical codes, as well as requirements from healthcare accreditation organizations. 19thly, it's important to stay up to date with the latest codes and regulations to ensure that the electrical system in the dental facility is safe and compliant. This may involve attending continuing education courses, subscribing to industry publications, and consulting with qualified electrical professionals. 20thly, the use of isolated ground receptacles is not limited to dental facilities. They are also commonly used in other environments where sensitive electronic equipment is used, such as hospitals, laboratories, and recording studios. 21stly, in these environments, the benefits of minimizing electrical noise and interference can be even more significant, as the accuracy and reliability of the equipment can have a direct impact on patient care, scientific research, or artistic expression. 22ndly, the selection of the appropriate type of receptacle for a particular application is also important. There are several different types of isolated ground receptacles available, each with its own specific features and benefits. 23rdly, some isolated ground receptacles are designed to be used with specific types of equipment, while others are more general purpose. It's important to choose a receptacle that is compatible with the equipment that will be connected to it and that meets the requirements of the application. 24thly, the proper installation and maintenance of isolated ground receptacles are essential to ensure their continued performance and reliability. This includes regularly inspecting the receptacles for damage, verifying the tightness of the connections, and testing the grounding system to ensure that it is functioning correctly. 25thly, if any problems are detected, they should be addressed promptly to prevent any potential safety hazards or performance issues. 26thly, the isolated ground system is an integral part of the overall electrical system in a dental facility. It works in conjunction with other components, such as surge protective devices, to provide a comprehensive level of protection against electrical disturbances. 27thly, surge protective devices, or SPDs, are designed to protect sensitive equipment from voltage surges, which can be caused by lightning strikes, power outages, or other electrical events. 28thly, SPD are typically installed at the main electrical panel and at the point of use, providing multiple layers of protection. 29thly, when used in conjunction with isolated ground receptacles, SPD can help to further minimize the risk of electrical damage to sensitive equipment. 30thly, the effectiveness of an isolated ground system depends on several factors, including the quality of the installation, the design of the grounding system, and the level of electrical noise and interference in the environment. 31stly, in some cases, it may be necessary to take additional measures to reduce electrical noise and interference, such as installing filters or using shielded cables. 32ndly, the cost of installing isolated ground receptacles is typically higher than the cost of installing standard receptacles. This is due to the additional materials and labor required to install the two grounding conductors. 33rdly, however, the benefits of using isolated ground receptacles can outweigh the costs, especially in environments where sensitive equipment is used. 34thly, in these environments, the cost of downtime or equipment damage due to electrical noise and interference can be significant. 35thly, the decision to use isolated ground receptacles should be based on a careful assessment of the risks and benefits. This assessment should take into account the specific requirements of the equipment, the level of electrical noise and interference in the environment, and the cost of installation. 36thly, by carefully considering these factors, dental facilities can make informed decisions about the use of isolated ground receptacles and ensure the safe and reliable operation of their sensitive equipment. 37thly, it is also important to ensure that all electrical work is performed by qualified and licensed electricians who are familiar with the NEC and other applicable codes and standards. 38thly, using unqualified or unlicensed electricians can result in unsafe installations that may not meet code requirements and could pose a safety hazard. 39thly, the installation of isolated ground receptacles is a complex task that requires specialized knowledge and skills. It is essential to use electricians who have the necessary training and experience to perform the work safely and correctly. 40thly, in addition to the technical aspects of installing isolated ground receptacles, it is also important to consider the ergonomic aspects. The receptacle should be installed at a convenient height and location, and they should be easy to access and use. 41stly, this is especially important in dental facilities, where healthcare professionals may be using the receptacles frequently throughout the day. 42ndly, the use of color-coded receptacles can also help to improve ergonomics. Isolated ground receptacles are typically orange in color, which makes them easy to identify. 43rdly, this can help to prevent accidental plugging of equipment into the wrong receptacle, which could result in damage to the equipment or a safety hazard. 44thly, the installation of isolated ground receptacles is just one aspect of a comprehensive electrical safety program. A comprehensive electrical safety program should also include regular inspections, testing, and maintenance of the electrical system. 45thly, it should also include training for healthcare professionals on how to safely use electrical equipment and how to recognize potential hazards. 46thly, by implementing a comprehensive electrical safety program, dental facilities can help to protect their patients, staff, and equipment from electrical hazards. 47thly, the NEC is updated every 3 years, so it is important to stay informed about the latest changes. This can be done by subscribing to industry publications, attending continuing education courses, and consulting with qualified electrical professionals. 48thly, the NEC is a complex document, but it is essential for ensuring electrical safety. By following the NEC guidelines, dental facilities can help to create a safe and reliable electrical environment. 49thly, the use of isolated ground receptacles is a best practice for dental facilities that use sensitive electronic equipment. By minimizing electrical noise and interference, isolated ground receptacles can help to improve the performance and reliability of the equipment, reduce the risk of errors and malfunctions, and enhance the overall quality of patient care. 50thly, the information provided in this narration is for general guidance only and should not be considered a substitute for professional electrical advice. Dental facilities should consult with qualified electrical professionals to determine the specific requirements for their facilities and to ensure that all electrical work is performed in accordance with applicable codes and standards.